Hi everyone, my name is Vanessa Rosales, a medical technologist intern of Butuan Doctors College. This case study is about Ebola virus diseases. In 1976, scientists first identified Ebola in what is now a Democratic Republic of the Congo. Since then, sub-Saharan Africa has been affected by periodic Ebola outbreaks. The West African outbreak that began in 2014 and ended in 2016 was the largest ever recorded, with 15,261 laboratory confirmed cases, according to the World Health Organization. During that outbreak, 10 people with Ebola were treated in the US. 2 acquired it in the US, and the other cases were acquired in West Africa. Since Ebola requires direct contact to spread from person to person, the risk of an outbreak in the US is very low. Patients are not routinely tested for Ebola. A person may be tested if that person recently visited an area where the virus was reported and have symptoms, or if someone knows that he or she has been exposed to the virus and have symptoms consistent with an Ebola infection. What is Ebola virus disease? It is a single-stranded RNA virus. Ebola disease is a severe, often fatal illness in humans and other primates caused by Ebola virus. The virus is transmitted to people from wild animals and then spreads in the human population through human-to-human transmission. There have been 5 species of Ebola virus that have been identified: Ebola virus, Sudan virus, Thai forest virus, Bundibugyo virus, Reston virus, and Bombali virus. Among them, the 2014 to 2016 outbreak of Ebola virus disease in West Africa involving Zaire Ebola virus was the largest outbreak of Ebola virus disease in the history. The condition was formally referred to as Ebola hemorrhagic fever, has a high risk of death, killing 25% to 90% of people who are infected. Pathophysiology. Stages of Ebola virus disease.
The Ebola virus is a highly aggressive virus that is transmitted through bodily contact with an infected, symptomatic individual. The Ebola virus enters the body primarily through direct contact of mucous membranes, like the eyes, or through abrasions in the skin. When inside the body, the virus fuses with tissue cells, invades them, and releases its genetic content into the cell. This is similar to many viruses, wherein the viral RNA uses the host cells to generate copies of itself. The genetic material takes over the cell machinery to replicate itself. New copies of the virus are formed, released into the system, and dispersed. This also causes the cells to explode, sending infectious particles flying. Ebola then overpowers the immune system. The very cells that are meant to fight infection are used as carriers to spread infection to other body parts, including the liver, spleen, kidneys, and brain. The virus attacks almost every organ and tissue in the human body, resulting in an overwhelming inflammatory reaction. This is what causes sudden flu-like symptoms that are the first signs of Ebola.
Epidemiology. The Ebola virus causes an acute, serious illness which is often fatal if untreated. Ebola virus disease first appeared in 1976 in two simultaneous outbreaks, one in what is now Nazara, South Sudan, and the other in Yambuku, DRC. The latter occurred in a village near the Ebola River, from which the disease takes its name. The 2014 to 2016 outbreak in West Africa was the largest Ebola outbreak since the virus was first discovered in 1976. The outbreak started in Guinea and then moved across land borders to Sierra Leone and Liberia. The current 2018 to 2019 outbreak in eastern DRC is highly complex, with insecurity adversely affecting public health response activities. Early on, Ebola can feel like the flu or other illnesses. Symptoms show up 2 to 21 days after infection and usually include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, lack of appetite. As the disease gets worse, it causes bleeding inside the body, as well as from the eyes, ears, and nose. Some people will vomit or cough up blood, have bloody diarrhea, and get a rash. Diagnostic workup. The preferred specimen for diagnosis include whole blood collected in ethylene diamine tetraacetic acid from live patients exhibiting symptoms, oral fluid specimen stored in universal transport medium collected from deceased patients or when blood collection is not possible. Samples collected from patients are an extreme biohazard risk. Laboratory testing on non-inactivated samples should be conducted under maximum biological containment conditions. All biological specimens should be packaged using a triple packaging system when transported nationally or internationally. Confirmation that symptoms are caused by Ebola virus infection are made using the following diagnostic methods: antibody capture enzyme-linked immunosorbent assay, known as ELISA, antigen capture detection tests, serum neutralization test, reverse transcriptase polymerase chain reaction, electron microscopy, virus isolation by cell culture. Careful consideration should be given to the selection of diagnostic tests, which take into account technical specifications, disease incidence and prevalence, and social and medical implication of test results. It is strongly recommended that diagnostic tests, which have undergone an independent and international evaluation, be considered for use. Treatment. There are no licensed therapeutics to treat Ebola. The researchers are evaluating potential immune therapies, blood products, and drugs. Ebola treatment currently involves addressing symptoms and controlling complications such as severe dehydration, electrolyte imbalances, septic shock, and organ failure. Early supportive care can improve Ebola survival. Definition of terms. Marburg. Hemorrhagic fever is a severe, highly fatal disease caused by a virus from the same family as the one that causes Ebola hemorrhagic fever. Hantavirus is a disease that is passed through rodent bodily fluids, though the virus can be passed from human to human in very rare cases. Most cases come directly from contact with infected rats. NAT, or nucleic acid test, is a technique used to detect a particular nucleic sequence and thus usually to detect and identify a particular species or subspecies of organism, often a virus or bacteria that acts as a pathogen in blood, tissue, and urine. Enzyme-linked immunosorbent assay is an immunological assay commonly used to measure antibodies, antigens, proteins, and glycoproteins in biological samples. Reverse transcription polymerase chain reaction is a laboratory technique combining reverse transcription of RNA into DNA and applications of specific DNA targets using polymerase chain reaction. It is primarily used to measure the amount of a specific RNA. This is achieved by monitoring the amplification reaction using fluorescence, a technique called real-time PCR or quantitative PCR.